So as you see, we've got the cerebrum here, the cerebellum here, pons, midbrain down here, and it's unfortunate it's kind of disrupted right here, but the leptomeninges is kind of torn away. But if we take a closer look in this area right here, there's these little granular areas which are called arachnoid granulations, which a lot of people mistaken for tumor. I'm going to try to zoom in on that. Anyways, we're going to continue on with the dissection. The first thing that I like to do is dissect out the circle of Willis. So if you take a look, right in this area right here, there's a bunch of leptomeninges surrounding a bunch of vessels in this area. And anyways, right here you've got the right vertebral artery, left vertebral artery, the basilar artery. And then what I'm going to do is I'm going to kind of dissect away this leptomeninges and then come back to this and show you the circle of Willis in more detail. Alright, so I'm back after kind of dissecting away the leptomeninges, kind of surfacing the circle of Willis. So let's go over the anatomy once more. So because your vertebral arteries here, your basilar here, down to this area, in this area are your your posterior cerebral arteries, and then you have a communicating posterior artery on this side and on this side. These, of course, are your internal carotids here and here. Here's your olfactory nerves, optic nerves. So now what's going to happen is I'm going to go ahead and continue to dissect out the circle of Willis. If you look right here, there's a little bit of discoloration, which is maybe a little bit of atherosclerosis, early atherosclerosis. So I'll come back in a minute with this dissected out and we'll continue. Alright, so I've dissected out the circle of Willis and kind of laid it out for you. It's kind of a tedious dissection, but let's go through these again. Vertebral, basilar, posterior cerebral arteries, and you got your posterior communicating. I got a little bit of nerve here. These are internal carotids here. This is your anterior cerebral artery. And then, of course, you've got up here your anterior communicating right here. So now we're going to go ahead and go to the rest of the brain dissection.
This is the complete dissection of the circle of Willis. I first began removing the leptomeninges, which is a combination of two membranes, the pia and the arachnoid membranes. The leptomeninges has the consistency of a cobweb, and it surfaces the circle of Willis in this area. So we've got to remove those membranes and expose the vessels I need to transect in order to get out the circle of Willis. Now, as I section through the membranes on this side, you'll see a longitudinal portion of vessel, which is your left middle cerebral artery. Now, in this area, there's some leftover tentorium, which is right there. I'm going to cut that away so I can expose the the left posterior and superior cerebral arteries. This is a tedious process, but once you get done and you've taken out the circle of Willis, there's a lot of satisfaction in taking it out complete and intact, and I know the pathologists appreciate it as well. So I'm adjacent to the optic nerve, our optic nerves right here, cutting through some more of the elliptomeninges. There's the left internal carotid. There's a basilar. I'm holding on to the vertebral arteries. And I'm also cutting the thread-like branches deep to all these cerebral arteries in order to remove the circle Willis. So here I'm in the area of the anterior cerebral arteries. Now I'm moving on to the right side, adjacent to the right superior and right posterior cerebral arteries. So I transected the left superior and posterior cerebral arteries. I'm going to transect the left middle cerebral artery there. And once again, there's a lot of thread-like branches off all these cerebral arteries that you have to cut. Now I'm going to transect the right middle cerebral artery. And now I'm going to work once again in the area of the anterior cerebral arteries and the anterior communicating artery. I'll try to keep intact and take along with those arteries in that area. I pulled up the basilar artery. I'm going to cut those deep thread-like branches that come off of these vessels. And try not to cut through the posterior communicating arteries. Really want to try to keep this the circle Willis intact. So I'm giving a little bit of traction by grabbing onto the basilar artery. This is a tedious process and you kind of have to take your time. Now I'm going to make sure, once again, I've got those anterior cerebral arteries, and I'm going to kind of pull it over the top of the optic nerves and try to free up all those structures there. Holding on to the, I just got to finish holding on to the right optic nerve and the right internal carotid vessels or arteries. And that's the process of just finishing up the deep thread-like branches in this area. I'm holding on to the left optic nerve. I'm now pushing it underneath the anterior cerebral arteries. I'm going to try to just really free up the circle Willis now. Kind of pushing the optic nerve down, pulling the anterior cerebral arteries towards me. Getting those deep thread-like branches. So a few more. Almost done. And there you go. We're moving on to the brain sectioning. I've already removed the cerebellum and brainstem. And now I'm going to divide the brain into anterior and posterior halves by cutting through the mammillary bodies, as you see here. And so this is just a lid from a specimen container. I'm going to do the anterior half first. Please note the laterality noted here. And so I'm going to make these sections. They're about 1 centimeter in thickness. And once again, I'm using a lid to kind of make the sections more uniform. Now pay attention to the way I flip these slices and lay them out. So I'm flipping the slices once again. And it's real important to keep the orientation the same and kind of do the same thing with every slice and how you orient it on the cutting board. As you notice here, I make an error and I do not flip it over. And so the laterality has changed here. And that's real important to make sure, once again, that you lay out the slices the same and do the same. If you decide to flip them over like that, make sure you do them on all the slices in that particular half of the specimen. And it's important because if you have a lesion in one slice and you're not paying attention and you flip the adjacent slice, it may look like there's two lesions within the brain. And so anyways, I did find that error when I was rewatching this particular video. So now we're going to move on to the posterior half, and you'll notice the laterality once again. Okay. And as far as sectioning goes, I am doing a little bit of a sawing motion, but if you can do the least amount of sawing with the blade here, you'll have less artifact on the cut slices or the cut sections. So do the best you can. Now as I flip these, you'll see the laterality of the posterior half of the cerebrum. Once again, just pay attention to the orientation. So I'm just continuing my slices and kind of laying them out. And you also have the option, if you are worried about the laterality, you can always throw a little bit of ink on one hemisphere of the brain, the right side or the left side, especially when you first start doing these type of brain dissections. So now that I've actually sectioned the anterior half of the cerebrum and the posterior half of the cerebrum, now I'm going to divide the brainstem and medulla from the cerebellum by cutting through the cerebellar peduncles. And you'll notice the right cerebellum, I've actually put a little bit of black ink over that area, and because I find it's somewhat difficult to maintain the orientation sometimes with the cerebellum anyways. So I'm cutting through those peduncles and dividing the brainstem and medulla from the cerebellum. And so the brain, I perform coronal sections. The brainstem and medulla, I'm going to perform just transverse sections and put those in chronological order. And at the end of this, I usually take a photograph of everything and put it into the case. Often the pathologist relies on us to perform these brain dissections, photograph or photo document the case, put it in the case, because they may not be on site. They really rely on us to do a thorough job and document everything. So once again, I'm just sectioning through the brainstem, starting at the substantia nigra, moving down to the medulla, and then I'm just going to lay these out chronologically. Or sequentially, I should say. So there we have it, from the substantia nigra down to the medulla in a sequential fashion. Kind of cleaning up my cutting board as I move on to the cerebellum. Now I'm going to divide the cerebellum into the right and left halves, and then I'm going to perform more of a sagittal cross-sectioning of the right and left sides. And what I try to do is I try to put these in sequential order fashion as well, but I make sure I try to make the same number of slices on the right side as the left side. As you can see here. Once again, clean up the cutting board as I move on, so I can make this photo documented or worthy for photo documentation. Okay, now sectioning the other half. Putting those in sequential fashion. And you notice the one side I have 6 slices, this side I have 7 slices, so I'm going to make an additional section for this last portion of cerebellum here to make it more even. There you have it. Now, if there's no pathology, we just take these usual, routine sections from one half of the brain here. There's no pathology. Thank you for watching.